by me, Rian, Darren, and Daniel, and Daniel. Next slide, please. So we're going over what is neurology, the anatomy of the nervous system, neurological disorders, brain imaging, and career path. Next slide, please. So a neurologist is a medical professional specializing in the diagnosis and treatment and management of disorders related to the brain and nervous system, which includes the brain, spinal cord, and nerves. They know the anatomy, function, and conditions that affect your nerves and nervous system. Next slide.
Okay, so first off, we're going to be going over the anatomy of the nervous system. So the nervous system consists of two parts, the central nervous system and the peripheral. And within the central nervous system, there's the brain and the spinal cord. So the brain consists of the cerebrum, cerebral cortex, the cerebellum, and the brainstem. And within the spinal cord, there is 31 segments, which is the cervical, which has 7 segments. The thoracic has 12. Lumbar has 5 segments. The sacral has 5 segments also. And the coccygeal has just one, which is the tailbone. And the peripheral nervous system is everything other than the central nervous system. And it's basically all your neural pathways that connect to the rest of your body. And within this, there's two main branches, which is the somatic and the autonomic. The somatic first is in charge of any voluntary movements, whether it be like your arm moving or your leg moving. And it's also in charge of like transmitting any of your sensory neurons to the central nervous system. And the other branch is the autonomic nervous system, which is in charge of the involuntary or automatic functions, which includes like breathing, like heart beating and digesting, things that you wouldn't like have to be consciously aware of. And within the autonomic has another subdivision, which is the sympathetic and the parasympathetic nervous system, which is in charge of your fight or flights. Yeah. Okay, next is going to be like neurological diseases. First up is epilepsy. So epilepsy is described as a chronic disorder, which is the reoccurrence of seizures caused by a neurological disorder. And there are many types of epilepsy. The main focus ones are going to be the generalized or focal. And that just means that focus is going to target a specific part of your brain, whereas generalized epilepsies just means that it's going to have multiple parts of your brain that will be affected. So first off is absence epilepsy, which consists of seizures that causes momentary gaps in consciousness, and they could be seen making random purposeless movements like arm jerks, rapid blinking, and that sort of stuff. And afterwards, they'll return back to their normal behavior. These seizures happen very frequently and can interrupt normal life. Next one is the frontal lobe epilepsy. This is also a pretty common epileptic disorder, and it is the occurrence of a clustering of focal seizures, and which are seizures that derive from like a specific or focused location. And this causes uncontrolled limb and muscle movement, and it causes the eyes to also like move out of focus. And this usually occurs when you are asleep, but can also happen when you are awake. The last one is the temporal lobe epilepsy, and this is the most common type of epileptic disorder. And it is correlated with feelings of nausea and unordered smells or taste. Individuals in this epileptic state can be seen with staring spells, which basically means that they're looking, but they aren't like their eyes aren't in focus and they aren't seeing anything really. And it also has involuntary like physical movements. There's also been research confirming that there's a high correlation between the temporal lobe epilepsy and the shrinkage of the hippocampus. And the hippocampus is actually in charge of your memory. So who does this affect? Epilepsy is actually very common and it doesn't really target a specific like age, gender, or race. It's like it affects everyone pretty much. And it affects about 1.2% of the US population, which is around 4 million people. And some certain conditions that could lead to epilepsy include like brain tumors, head traumas, alcoholism, Alzheimer's, strokes, and brain inflammation. So all like issues regarding the brain. Yeah.
Next is Alzheimer's disease. So it's a brain disorder that slowly destroys memory and thinking skills and affects about like 55 million people around the world. And people who have Alzheimer's are mostly in their 60s or older. And there are two types of Alzheimer's, early onset and late onset. So early onset is diagnosed in people in their 40s and 50s, and the symptoms are asking for the same information or losing track of time and being confused on where you are. And late onset is the most common, and it happens in people ages 65 and older. The symptoms are memory loss, misplacing things, and losing the ability to retrace steps. There are also Alzheimer's, familial Alzheimer's, which is connected by genes in families, and those are who are affected have at least two generations, and the symptoms are from early and late onset. Next slide, please. So Parkinson's disease is a brain disorder that causes uncontrollable movements, and symptoms are like shaking, stiffness, and difficulty with balance and coordination. And about 1 million Americans are diagnosed, and their ages are 60 and older. Um, yeah, symptoms are like tremor in hands, legs, arms, jaw, or head, muscle stiffness, where muscles remain contracted for a long time, and the slowness of movement and impaired balance and coordination sometimes leads to fall. And uh, and doctors usually diagnose the disease by taking a person's medical history and performing a neurological exam. And there is no cure for Parkinson's disease, but medicine, surgical treatment, and other therapies are often relief some symptoms of the disease.
So the Huntington's disease is a genetic or a very rare genetic disorder that affects the brain and causes nerve cells to start breaking down and die. It greatly impacts a person's behavior, mental capacity, and a range of motion. Symptoms of a Huntington's disease usually develop between ages 30 and 50, but they can appear as early as age 2 or as late as 80. Since the illness progresses over time and has no known cure, symptoms get worse with time. This happens between this happens because of a genetic mutation of the HTT gene, which generates the Huntington protein, which is the cause of the Huntington's disease. When CAG repeats itself, an unusually long pattern of DNA repeats found in that of HD patients. This sequence usually happens 10 to 35 times. However, in those with Huntington's disease, it occurs over 36 to 39 times. Because of this mutation, the defective Huntington protein is produced, which eventually deteriorates and kills the brain's nerve cells, especially those that control movements, thoughts, and emotion. Now, in the visual example in the normal brain, the basal ganglia and the cortex appear complete and distinct. Also, since there are very few gaps between the brain tissues and the neurons are closely spaced, the brain is functioning properly. However, in the Huntington's disease brain, the brain neurons are dying, leading to shrinkage of the basal ganglia. And you can see here because the loss of neurons, the basal ganglia looks shrunken and deteriorated, which is causes more space between the brain tissues. Enlarged ventricles appear, indicating brain tissue loss unlike the normal brain. Additionally, the cortex also shrinks, especially in areas related to critical thinking and emotions. I keep talking about the basal ganglia, and you might be wondering what that even is and why I keep mentioning it. The reason it's so important is that the basal ganglia main function is to control consciousness and proprioceptive movements like being able to walk or kick without looking at your feet, or being able to touch your nose with your eyes closed. So in the real picture, you can see on the top left, the Huntington's disease brain. It, it's a real image of a person's brain, and it shows the brain section showing the dilation of the ventricles. Next slide, please.
Okay, and now we'll be going over strokes. So strokes are classified as a medical emergency that can cause long-term brain damage, and it can also result in disability or death. There are two main types. They include ischemic and hemorrhagic. Ischemic is when the blood flow to the brain is blocked, so that stops the brain from getting oxygen and nutrients. And when this happens, the brain cells begin to die very quickly. Um, it can be treated as a blood clot can be dissolved or broken up by certain types of medications. And 87% of all strokes in the United States are ischemic. Hemorrhagic strokes are when there's sudden bleeding in the brain. And that damages the brain cells since the blood flow then puts pressure on those brain cells. And these strokes can result from high blood pressure, aneurysms, head injuries, or arteriovenous malformation. And that is a condition in the brain where blood is sent from the arteries like directly to the brain, um, bypassing the brain tissue. And when these strokes do happen, the blood can be drained from the brain to relieve the pressure, and the damaged blood vessels can also be repaired. There are other types of strokes, including transient ischemic attacks, cryptogenic strokes, brainstem strokes, and recurrent strokes. So transient ischemic strokes or attacks are basically like mini strokes, resembling an ischemic stroke, but lasting for only a few minutes. And when one of these happens, it may not cause permanent damage, but it is like a warning sign that a full ischemic stroke may happen in the future. So when these strokes do occur, it's recommended that patient go see a doctor just in case. Cryptogenic strokes are strokes that have an unknown origin. So a patient does have a stroke, but doctors can't just figure out where or what caused it. A brainstem stroke is when you have a stroke that's kind of in the brainstem area. And like Daryl mentioned earlier, the brainstem is very important anatomy. It controls essential functions like breathing and heartbeat and consciousness. So brainstem strokes can be very debilitating on the patient. And a recurrent stroke is just a condition where you will have multiple strokes. And having one stroke does increase the likelihood that you will have another. And with each stroke, it's more and more likely that you'll experience serious complications. Um, and symptoms of strokes include weakness, paralysis, and numbness on one side of the face or body. And it can also include sudden and severe headaches, sudden weakness, or like trouble speaking, seeing, or understanding speech. Next slide.
Okay, so carotid artery disease. So the carotid arteries are basically the major blood vessels responsible for blood flow to your brain. And this disease is basically when those arteries are blocked or the passageway is narrow. So this could be caused by the buildup of plaques, which are fatty deposits made of cholesterol, fat, and blood cells. And this basically clogs the blood vessels. And it increases the risk of stroke and leads to TIA, which were touched on in the previous slide. And some factors that can actually increase the risk of carotid artery disease include high blood pressure, tobacco use, diabetes, sleep apnea, lack of exercise, obesity, and age, and even family history. There's some treatment methods, namely the medicine and surgery, but there's also lifestyle changes. For example, like not consuming tobacco, regular exercise, and maintaining like proper weight. Um, so carotid artery disease, there isn't any like early symptoms for it, because when you kind of do experience it, it'd be a bit too late. But symptoms of TIA and stroke, as said previously, include sudden numbness or soreness in the face or limbs, inability to speak or understanding speech, difficulty seeing, dizziness, and headaches.
Right. And now we'll be going over Bell's palsy, which is a condition where one side of the face experiences sudden weakness in its muscles. And in very rare cases, it can affect the nerves on both sides of the face. So it does have an unknown cause, but doctors think that it may come from swelling or irritation to the nerves that control the muscles that are found in that side of the face. And it's also been linked to some like viral infections, including chickenpox, respiratory illnesses, mumps, flu, and hand, foot, and mouth disease, and other types of viral infections. Symptoms tend to improve in a few weeks, but complete recovery does tend to be around 6 months. And again, in very rare cases, these symptoms can last for life, or it can occur more than once. And symptoms of Bell's palsy include weakness or total paralysis of one side of the face, facial droops, pain around the jaw, or pain in or behind the ear, headaches, loss of taste, and increased sensitivity to sound on the affected side, as well as like the changes in the amount of tears or saliva and drooling on one side of the face. And this condition may result in irreversible damage to the facial nerve, or irregular growth of the nerve fibers. So that can result in involuntary muscle contraction when you want to move like other muscles of your face. And it can also result in partial or complete blindness of the eye on that affected side of your face.
All right, so now we're going to the autism spectrum disorder, ASD. It is the autism spectrum disorder is often described as an umbrella term that involves a wide range of characteristics and actions that change greatly from person to person. Although some people with ASD can live their lives without much help, others require substantial support. The team of the term spectrum draws into focus the number of ways in which autism impacts people with disabilities, including variations of behavior, communication, and processing of sensory information. Now, what is it like for autism for an individual? Imagine entering a crowded space where everything seems more intense. The lights are brighter and the sounds are louder. Daily life can feel like that for some people with ASD. People with ASD may find it difficult to understand the details of human interaction and sensory inputs like lights, noise, and sometimes textures to be overwhelming and unbearable. Others on the spectrum may become very focused on particular interests or hobbies and find it more soothing. Now, as you can see on the screen, there are three levels of autism spectrum disorder. The first level is requiring minimal supports for the individual. Still, with some assistance, individuals can normally engage in verbal communication and social interactions. Sometimes they can often manage these behaviors in structured environments like work or school. The second environment the second level is needing substantial supports. Individuals may have more serious social and behavioral problems at this stage, needing constant support. They might have more trouble communicating verbally as well as non-verbally, and they might find it harder to start or continue social interactions on their own. Also, repetitive actions and strong concentration on one subject are more noticeable and may become in the way of day-to-day tasks. At this level, individuals often need more structured support, such as assistance with daily routines and guidance with adjusting to changes. Level 3 is requiring very substantial supports. Level 3 autism is generally regarded as the most severe form of autism spectrum disorder. People at this level require an enormous amount of assistance in the majority of daily activities because to their severe communication, social interaction, and behavioral challenges. People with level 3 autism require constant support and supervision in almost all parts of life. This involves support with everyday tasks, including eating, dressing, and maintaining personal hygiene. The diagnosis of autism is based on looking at behavioral, developmental history, and structured evaluations. To properly evaluate and diagnose autism, a multidisciplinary team consisting of pediatricians, neurologists, psychologists, and speech therapists is involved instead of using medical tests like blood work or imaging. Next slide, please.
Okay, and now we'll be going over brain imaging and different types of brain imaging. So brain imaging encompasses scans that show very clear images of the structures within your head. It's used for different reasons, including like diagnosing disorders, identifying effects, locating tumors, finding swelling and bleeding, as well as conducting research. So very common types of imaging include fMRIs, CTs, PET scans, and EEGs. So fMRIs that stands for functional magnetic resonance imaging. This detects changes in blood flow and oxygen levels in your brain. That assesses brain activities, finds abnormalities in the functions of your brain, and create brain maps for surgery. And it can also measure metabolic function. These are different than MRIs, which display your brain structure and anatomy, and are very detailed versions of like CT scans. So CT scans or computerized tomography, those are like X-ray images of your brain, and they can be used to create a 3D model if necessary. And they provide more detail than a standard X-ray of your head might. They find certain types of brain injuries, they can identify cancer, and they can also locate certain swelling or bleeding within your brain. PET scans or positron emission tomography. Those trace glucose in your bloodstream using a radioactive tracer. That allows doctors to see areas where glucose is not moving correctly in your brain. And that helps doctors evaluate seizures, Alzheimer's disease, and also like tumors and where they are in your brain. EEGs or electroencephalograms do measure brain waves through small electrodes on your scalp. So doctors will place like electrodes on the scalp of their patients, and that creates an image very similar to a graph that shows like the waves and activity of your brain. And those detect issues such as anxiety, head injuries, epilepsy, and disruptions in your sleep.
Next, is the career path, which is the neurologist path. So again, neurology is a part of medicine that focus on understanding and treating problems with the nervous system. It takes up to 12 to 13 years of education and training, and the salary is $260,000 in the US. But the steps to become a neurologist is 4 years in undergrad school, 4 years in medical school, 1 year in internship at a teaching hospital, 3 year neurology residency program, and 1 or 2 additional years of in specialties, which is optional. It includes like child neurology, neuro-oncology, and sleep medicine. And after that, you just become board certified. Next slide, please. So start, we're excited. Excited. Yeah, thank you guys for coming and also listening. We do have a Kahoot, but if you guys have any questions, please do type them in the chat. Should I share my screen for this?
Yeah, if you could, that'd be great. Thank you so much. But let me give you the permission. Okay.
Do you guys share see my screen?
Wait, I don't see it.
It's not allowing me to share my screen.
Okay, great. If you guys can see it, I think the code is 1173111. We're getting started. You can continue to join at your convenience. So the first question, what is the primary focus of a neurologist? Oh, sorry, wait, Abby, you can go ahead. Sorry.
Yes, okay.
Okay, so primary focus of a neurologist is to diagnose and manage disorders of the brain and the nervous system. The heart, bones, and digestive issues are things that other specialists would look at, not a neurologist. Okay. And then next question, which of the following correctly describes the structure of the central nervous system? Okay, perfect. Everyone got that right. Central nervous system includes the brain and spinal cord, and then the peripheral nervous system includes all the other nerves. Okay. Daryl's in first place. I think you presented on this topic, right? Okay. Next question. What is epilepsy? Yeah, so epilepsy is a condition that is characterized by recurrent seizures, and it doesn't only affect the elderly, it affects people of all different ages. Okay, next question. Which type of epilepsy is characterized by temporary gaps of consciousness and purposeless movement? So if you remember, we went over several different types of epilepsy. Yeah, this one's a little tricky, but the absence epilepsy is a type that causes gaps in consciousness and purposeless movements. Okay. And then what is the primary impact of Alzheimer's disease? Okay, great. Yeah, a lot of people got this one right. Alzheimer's disease slowly destroys memory and thinking skills, the neurodegenerative disease. Okay, great. And the next we have true or false. Alzheimer's disease only affects individuals aged 65 and older, and there is no early onset form of the disease. Okay, great. So this is false. There is early onset and late onset Alzheimer's disease, as Abby talked about. And what is a common method for diagnosing Parkinson's disease? Yeah. So usually use medical history and neurological examination. A lot of times, like when you're diagnosing disease, you consider multiple factors just to confirm. Okay. And then which of the following symptoms is associated with Parkinson's disease? Right. So, slowness of movement is associated with Parkinson's disease. Okay. And then next we talked about Huntington disease. So what happens to the brain during this? Okay, yeah. So, during Huntington's disease, you're losing the brain cells because the ventricles are the holes that Nathaniel pointed out. So they expand because the brain cells and the matter in the brain are um degraded by the Huntington's disease. Um, so basically, you have basal ganglia shrinkage, and the neurons are actually less packed and healthy, and the ventricles are increasing in size. Okay. And then next we talked about strokes and several of the symptoms. So which of the following is not a common symptom of stroke? Right. So during a stroke, you might have a headache, you might have difficulty walking and balancing or speaking. And then a lot of times if the stroke is on one side of the body, or on one side of the brain, you'll see changes on the opposite side of the body where you can't move. So there's like weakness or numbness. And coughing isn't associated with stroke. And then what is carotid artery disease? Right, so this is characterized by high blood pressure, viral infections, and excessive exercise or other um, causes that aren't related to this disease. Okay, and then what is a possible long-term effect of the condition that affects facial muscles in Bell's palsy? Okay, this is good. Yeah, everyone got this right. Good job. And one of the main traits of autism spectrum disorder is difficulty with social interaction and communication. And this is true or false question. Perfect. Yeah. So Daniel went over kind of the three levels. And there's kind of like um it gets more severe, like how these people are affected by the social interaction and communication. Okay. And then which type of brain imaging is used to assess brain activity by detecting changes in blood flow and oxygen levels? Okay, I think this is a tough question. So basically there are the brain imaging serves as like two functions. So one is like to tell you the structure of the brain, and you have a CT and MRI to do that. Then there's a functional part, like a imaging technique for functional part, and that's the EEG. So if you're a doctor and you're looking at EEG, you'll just see waves that tell you the activity in the brain, whereas a CT and an MRI is a picture of the brain and it's a black and white image. And so then there's two types of brain imaging that combines the structural and functional aspects of the brain imaging, and that's the fMRI, which is functional MRI, and then the PET scan. And those are what help you kind of they tell you more about the brain activity and where exactly it's located. So I think it's great that people mostly pick fMRI and PET scan, but in particular, the fMRI assesses blood flow and oxygen levels, and then the PET scan is more of a positron emission. Does that make sense? Like, let me know if there are more questions, if I can clarify that further. Okay. And then what is the primary purpose of a PET scan in brain imaging? Okay, perfect. Yeah. So the structural images, as I said earlier, is the MRI and CT scan, and then brainwaves is the EEG. So then for PET scan, they trace glucose in the bloodstream to look at metabolic activity. Okay. And then how many years of education and training does it typically take to become a neurologist? Yeah, 12 to 13 years. And we go over this every week not to scare you or deter you away from a career in these specialized fields. It's just that every field has a slightly different length of residency and training. Um, but only like in the first 4 years, right? 4 years of undergrad, you're learning like the basic knowledge. But then in medical school, in the first 2 years, you'll be learning things that are specific to medicine. And you can even do that in upper level classes in your undergrad pathway. And then in the second half of medical school, you're basically working in the clinic. So you're having those patient interactions, you're working with doctors, and there's definitely more of that in residency and fellowship. And you're basically assuming kind of like a role in the clinical setting in your residency and fellowship years. So that's going to help you become like a doctor. It's not like 12 to 13 years of like just straight school and memorization and reading textbooks. A lot of that time is actually dedicated to being in the field and learning about learning from the doctors and working in the clinical setting. Okay, and then last question, what is an optional step a neurologist can take after completing their residency? Yeah, so a lot of people are interested in strokes and different hemorrhages, and they can complete a fellowship in that subspecialty. And the fellowship is basically just working with a doctor who's like specialized in that field, and you'll be able to learn from them directly. And then after that fellowship, you can subspecialize in that specific disease. And then a lot of doctors also participate in clinical research, so like using what they observe in a clinical setting. To kind of improve treatments for future patients. Okay, and then congratulations to our leaderboard, and thank you everyone for playing and staying extra long. And it's supposed to end at 2:40, but or 11:40, sorry. Yeah, but let me know if you have any questions about the brain or anything else. Oh, and then thank you, Trisha, for answering all the questions. Sorry. Yeah, but I really a lot of the interns and we really like the brain. So yeah, happy to take any questions. If not, thank you for joining us this week. Have a good weekend.